For any parent, the child is a most precious gift of delight. Parents always wish happiness and success for the child, and try to fulfill all their needs and demands. Despite of all this unconditional love and care, if a child is unable to perform well at school, play on home and have trouble sustaining attention, being easily distracted by internal or external stimuli, jump from one task to another without completion, problems with organization, difficult in for using and executing on tasks, all this lead to many fears and worries in parents' mind. They start thinking, is everything okay with my parenting? Or is there something wrong with my child? Is everything okay at school? Hope no one is troubling my child at school or play. And the list is endless. Today in this video we will get an answer to all these queries from consultant homeopathy Dr. Makkar, child specialist. Attention deficit hyperactivity disorder, ADHD, and autism can look a lot like each other. Children with either condition can have problems focusing. They can be impulsive or have a hard time communicating. They may have trouble with schoolwork and with relationships. Although they share many of the same symptoms, the two are distinct conditions. Autism spectrum disorders are a series of related developmental disorders that can affect language skills, behavior, social interactions, and the ability to learn. ADHD impacts the way the brain grows and develops, and you can have both. The correct diagnosis early on helps children get the right treatment, so they don't miss out on important development and learning. People with these conditions can have successful, happy lives. When should you get your child evaluated for autism or ASD? If your child has any of these delays or behavior, consult your pediatrician as soon as possible for evaluation and treatment of autism or ASD. No babbling by 9 months. No pointing or gestures by 12 months. Not responding to their name by 12 months of age. No single words by 16 months. Lack of pretend play by 18 months. No two-word phrases by 24 months. Any loss of language or social skills at any age. Your infant or child resists cuddling and doesn't respond to his or her environment or to other people. Your child bangs his or her head or demonstrates self-injurious behavior or aggression on a regular basis. Your child demonstrates unusually repetitive behavior, such as repeatedly opening and closing doors, or turning a toy car upside down, and repeatedly spinning its wheels. Autism diagnosis is usually clinical, but special tools like Childhood Autism Rating Scale are available that help in diagnosing autism, assessing its severity, and differentiating it from other developmental disorders. How to diagnose autism? The Childhood Autism Rating Scale (CARS) is a behavior rating scale intended to help identify children 2 years and older children with autism, specifically distinguishing them from developmentally handicapped children who are not autistic. In addition, it distinguishes between mid to moderate and severe autism. Since its original publication, the CARS has become one of the most widely used and empirically validated autism assessment techniques. It has proven effective in discriminating between children with autism and those with severe cognitive deficits, and in distinguishing mild to moderate from severe autism. The Childhood Autism Rating Scale (CARS) is a 15-item behavioral rating scale developed to identify children with autism and to categorize these behaviors from mild to moderate to severe. Each item covers a particular characteristic, ability of behavior. The total CARS score may range from a low of 15, obtained when the child's behavior is rated as falling within normal limits on all 15 scales, to a high of 60, obtained when the child's behavior is rated as severely abnormal on all 15 scales. The score represents placement on a continuum. The lower the score, the fewer autistic behaviors the child exhibits. The higher the score, the more autistic behaviors the child exhibits. The scores are given as follows. Relating to people. Emotional response. Imitation. Body use. Object use. Adaptation to change. Listening response. Taste, smell, touch. Visual response. Fear or nervous. Verbal communication. Activity level. Nonverbal communication. Level and consistency of intellectual response. General impression. Total score. CARS evaluation is done by your primary healthcare provider by rating the child's behaviors from 1 to 4. 1 being normal for your child's age, 2 for mildly abnormal, 3 for moderately abnormal, and 4 as severely abnormal. Scores range from 15 to 60, with 30 being the cutoff rate for a diagnosis of mild autism. Scores 30 to 37 indicate mild to moderate autism, while scores between 38 and 60 are characterized as severe autism. Childhood Autism Rating Scale, 2nd edition. CARS-2, covering the entire autism spectrum, including Asperger's syndrome. The Childhood Autism Rating Scale, 2nd edition. CARS-2, helps you to identify children with autism and determine symptom severity through quantifiable ratings based on direct observation. Widely used and empirically validated, the CARS-2 has proven to be especially effective in discriminating between children with autism and those with severe cognitive deficits, distinguishing mild to moderate from severe autism. The CARS-2 addresses the following functional areas, among others. Relating to people. Body use. Visual response. Listening response. Taste, smell, and touch response and use. Verbal communication. Nonverbal communication. Level and consistency of intellectual response. The CARS-2 includes 3 forms. 1. Standard Version Rating Booklet, ST. Equivalent to the original CARS, for use with individuals younger than 6 years of age, and those with communication difficulties or below average estimated IQs. 2. High Functioning Version Rating Booklet, HF. An alternative for assessing verbally fluent individuals, 6 years of age and older, with IQ scores above 80. 3. Questionnaire for Parents or Caregivers, QPC. An unscored scale that gathers information for use in making ST and HF ratings. The Standard and High Functioning Forms. The Standard and High Functioning Forms each include 15 items addressing the following functional areas. Relating to people. Imitation, ST. Social emotional understanding, HF. Emotional response, ST. Emotional expression and regulation of emotions, HF. Body use. Object use, ST. Object use and play, HF. Adaptation to change, ST. Adaptation to change or restricted interests, HF. Visual response. Listening response. Taste, smell, and touch response and use. Fear or nervousness, ST. Fear or anxiety, HF. Verbal communication. Nonverbal communication. Activity level, ST. Thinking/cognitive integration skills, HF. Level and consistency of intellectual response. General impressions. Items on the standard form. Duplicate those on the original CARS. While items on the HF form have been modified to reflect current research on the characteristics of people with high-functioning autism or Asperger's syndrome. The clinician rates the individual on each item using a 4-point response scale. Ratings are based not only on frequency of the behavior in question, but also on its intensity, peculiarity, and duration. While this more nuanced approach gives you greater flexibility in integrating diagnostic information, it still yields quantitative results. How are they different? Keep an eye on how your child pays attention. Those with autism struggle to focus on things that they don't like, such as reading a book or doing a puzzle. And they may fixate on things that they do like, such as playing with a particular toy. Kids with ADHD lose initial interest, and they dislike and avoid things they'll have to concentrate on. You should also study how your child is learning to communicate. Although kids with either condition struggle to interact with others, those with autism tend to be self-centered. They often have a hard time putting words to their thoughts and feelings, and they may not be able to point to an object to give meaning to their speech. They find it hard to make eye contact. A child with ADHD, on the other hand, may talk non-stop. They're more likely to interrupt when someone else is speaking, or butt in and try to monopolize a conversation. Also, consider this subject. Some kids with autism can talk for hours about a topic that they're interested in. An autistic child loves order and repetition, but one with ADHD doesn't, even if it helps them. A child with autism might want the same type of food at a favorite restaurant, for instance, or become overly attached to one toy or shirt. They'll become upset when routines change. A child with ADHD doesn't like doing the same thing again, or for long times. When they occur together, there may be a reason why symptoms of ADHD and ASD can be difficult to distinguish from one another. Both can occur at the same time. Not every child can be clearly diagnosed. A doctor may decide only one of the disorders is responsible for your child's symptoms. In other cases, children may have both conditions. According to the Centers for Disease Control and Prevention, CDC, 14% of children with ADHD also have ASD. In one study from 2013, children with both conditions had more debilitating symptoms than children who didn't exhibit ASD traits. In other words, children with ADHD and ASD symptoms were more likely to have learning difficulties and impaired social skills than children who only had one of the conditions. Understanding the combination. For many years, doctors were hesitant to diagnose a child with both ADHD and ASD. For that reason, very few medical studies have looked at the impact of the combination of conditions on children and adults. The American Psychiatric Association, APA, stated for years that the two conditions couldn't be diagnosed in the same person. In 2013, the APA changed its stance. With the release of the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, the APA states that the two conditions can co-occur. In a 2014 review of studies looking at the co-occurrence of ADHD and ASD, researchers found that between 30 to 50% of people with ASD also have symptoms of ADHD. Researchers don't fully understand the cause for either condition, or why they occur together so frequently. Both conditions may be linked to genetics. One study identified a rare gene that may be linked to both conditions. This finding could explain why these conditions often occur in the same person. More research is still needed to better understand the connection between ADHD and ASD. Symptoms of ADHD and autism. In the earliest stages, it's not unusual for ADHD and ASD to be mistaken for the other. Children with either condition may experience trouble communicating and focusing. Although they have some similarities, they're still two distinct conditions. Here's a comparison of the two conditions and their symptoms. Being easily distracted. Frequently jumping from one task to another, or quickly growing bored with tasks. Unresponsive to common stimuli. Difficulty focusing, or concentrating and narrowing attention to one task. Intense focus and concentration on a singular item. Talking non-stop or blurting things out. Hyperactivity. Trouble sitting still. Interrupting conversations or activities. Lack of concern, or inability to react to other people's emotions or feelings. Repetitive movement, such as rocking or twisting. Avoiding eye contact. Withdrawn behaviors. Impaired social interaction. Delayed developmental milestones. Diagnosis. If you think your child has either ADHD or autism, talk to Dr. Makkar about what testing you will need. There's no one thing that can say whether a child has either condition, or both. You can start with your pediatrician, who may refer you to a specialist. To diagnose ADHD, doctors look for a pattern of behaviors over time, like being distracted or forgetful, not following through, having trouble waiting for a turn, and fidgeting or squirming. They'll ask for feedback from parents, teachers, and other adults that care for the child. A doctor will also try to rule out other possible causes for the symptoms. An autism diagnosis starts with a parent answering a questionnaire about the child, often about behaviors that started when they were very young. Further tests and tools may include more questionnaires, surveys, and checklists, as well as interviews and observed activities. Treatments. It can be hard for even doctors to tell the conditions apart. But it's important so your child gets the right treatment. There's no one-size-fits-all way to deal with ADHD. Younger kids start with behavior therapy, and the doctor prescribe homeopathic medication if symptoms don't improve enough. Older kids will usually get both. ADHD symptoms and their treatment may change over time. Different kinds of therapy. Behavior, speech, sensory integration, and occupational can help kids with autism communicate, and get along better with homeopathic medication. Medicine can't cure autism in modern medicine, but it may make related symptoms, like difficulty focusing or high energy, easier to deal with homeopathic treatment. Homeopathy treatment. Homeopathy treatment is based on the totality of symptoms, i.e., selection of the right remedy, considering the total symptoms of the patient. That include physical, mental, and spiritual entity. Homeopathy helps to treat the disease at its deep-seated causative point, so able to cure the disease in its actual term. In autism or ADHD, the frontal lobe of the brain is not well developed, which responsible for the slow expression of the executive function, like problem solving, attention, reasoning, planning, etc. That's why the child behaves in an abnormal way. Here one question comes in mind. Why that part of brain responsible for executive function develops slow, while in others' child case, its development is normal, though both are exposed to the same environment, diet, and social attachment. Yes, genetics can play a major role. But if the genetic is the only reason for autism or ADHD development, then why only 75% of autism or ADHD child have the hereditary etiology? Why not 100%? So, besides that, there is something hidden, dynamic causative factor that plays a major role in controlling, expressing and developing of all those pathological changes at the physical level. That stands for autism or ADHD disorders. If that could be treated successfully, then automatically the pathogenesis of autism or ADHD will gradually change to normal. The pathogenesis of slow development of frontal cortex or low synthesis of neurotransmitter dopamine are just the physical manifestation at the brain tissue level of some internal deranged dynamic causative factor, which till yet has not been detected by the medical science. Its presence is not at the physical level, rather at the emotional or dynamic level, which need to be fixed. A proper homeopathy treatment, based on body-mind-spirit level of holistic approach, can able to cure this disorder permanently. Now understand both separately.